And what my aim is really, and hopefully what you should get out of this session, is to get some practical tips of how to avoid common cognitive errors, to recall where we use deductive and inductive reasoning. Often though, those skills of problem solving we have to start with, and we kind of forget about them and start to take shortcuts. Some shortcuts can be useful, but often if we are shortcutting and forgetting how we think properly and how we think in a logical way, that can lead to errors of judgment. So we're going to talk about some strategies to avoid those errors, and that'll include things like heuristics and metacognitive strategies to avoid those errors. And we'll talk about how we use tests effectively, because one of the errors that commonly gets made is either poor test selection or selecting tests without considering why that test is being done, what we hope to get out of it. So really this kind of starts of Western medical problem-solving thought started to be formalized more by Francis Bacon in the 16th century in distinguishing what was referred to as science, so supportive evidence, from superstition. Before that time, most approaches were based on a mixture of this has always been done this way, this is an accepted dogma, often based on superstition rather than empirical observation. And Bacon promoted an inductivist philosophy whereby empirical evidence was gathered in order to make generalizations. So an empirical body of evidence was gathered, a body of unprejudiced observations, and then an inferred hypothesis or conclusion was drawn from those. One of the problems with this that the Scottish philosopher David Hume refuted was that in order to make those assumptions, there are still some preconceived ideas inherent in that. So this is still prone to a degree of superstition and bias. And for a while there was this degree of refutation and counter-argument about the inductivist philosophy of Francis Bacon. And it wasn't until some time later that the Austrian and British philosopher Karl Popper said, well, perhaps this is the wrong way round. Actually, if you are promoting empirical science, you don't actually need to infer a truth from gathering empirical data. Inherent in what we do as scientists is testing, is attempting to falsify information by testing, by effectively stress testing. If you're an engineer and you're trying different designs, part of that process may be to put those designs under a certain amount of stress and see whether they hold up to that, whether they withstand it. And it should be no different with diagnostic testing. So Popper promoted that empirical science is based on testable or falsifiable observations. So we have an observation, we do a test, we try and refute it. If we can't refute it, it stands up to that stress testing and is therefore valid. So what Popper proposed was a form of deductive reasoning, where rather than taking some observations and creating a hypothesis from that, we then take our hypothesis and we stress test it. We test to refute or still include possibilities. And that's the basis of what we are about when we perform diagnostic investigations or when we're investigating a problem. And we often use a mixture of these, both inductive and deductive reasoning. So inductive reasoning, we're taking some observations, making generalization. Deductive, we are stress testing that hypothesis, if you like, in simple terms. We're basically testing that. And that lends to a number of different potential diagnostic approaches. One that sadly often gets promoted, I think particularly by people with an interest in veterinary marketing more than anything else, is what's often referred to as a database comparison approach, where everything is examined. There is no real discrimination between what tests are performed. It's like having a trawler net and trawling for a lot of information. It's often really revoltingly referred to as a minimum database. The minimum database should really be a good history, physical examination and construction of a problem list from that. It shouldn't be just widespread use of diagnostic tests without thought, because that lends itself to other problems. So it's a pretty extravagant way of performing medical investigations. It also assumes that all test results are perfect, and we'll come on to that later, because actually the opposite's true, and the more tests you do, actually the more you tend to get false positive results and the more you tend to get conflicting results by doing it. It also assumes that the diseased patient will have a process going on that is known to you, that's familiar to you. So this approach doesn't really lend itself very well to if you're encountering a disease process for the first time that isn't in your personal database of cases I've seen in the past or cases I'm familiar with or problems I'm familiar with. So it doesn't really allow for that much adaptation. So it doesn't require much thought, and it's kind of a bit of a default process when people aren't prepared to expend that much thought thinking about their patients.